Thank you for joining us. Tonight, the Minnesota Attorney General is stepping in with outside mediators to help resolve a bitter dispute between the groups that make up mHealth Fairview.
This has major implications for more than 1 million patients and the future of the University of Minnesota Medical School. Danny Spiewak has been following the negotiations today and joins us now. Danny?
Well, Attorney General Keith Ellison announced today that the University of Minnesota, the doctors group known as mPhysicians, and Fairview Health will all return to the negotiating table. It comes just a week after mPhysicians and Fairview struck a deal themselves that has infuriated university leadership.
But what is the message?
The group mPhysicians represents more than 1,000 doctors who teach at the U of M Medical School and treat more than 1 million patients each year.
Many of these people have unusual problems that can't be cared for close to home.
This month, mPhysicians interim CEO Greg Bielman brokered a new 10-year agreement with Fairview Health. Under the deal, Fairview will continue investing in the U of M Medical Center it has owned since 1997, and mPhysicians will continue treating patients.
Very excited to do that work with Fairview, do that work as academic physicians.
But there's one missing piece in that agreement: the university itself.
This proposed agreement is not a path forward.
University President Rebecca Cunningham and the Board of Regents have accused mPhysicians of negotiating a deal erroneously and unlawfully, saying the agreement will make the doctors captive to Fairview. The U has been negotiating itself with Fairview over the future of the mHealth Fairview partnership that expires at the end of 2026.
mHealth Fairview has a certain reputation that the university and the research, etc., have helped to build.
Regent Mary Turner is also a nurse and longtime labor leader.
It needs to be all three entities at the table.
In a statement, the U says it's looking forward to restarting talks between the three parties with the help of the Attorney General and a mediator. As a regent, do you still have confidence in President Cunningham's leadership?
I certainly do. Yes, I have full confidence in her.
Fairview and mPhysicians confirm they'll participate in the talks, but they're not backing down from the agreement they reached, separate from the university.
You probably anticipated the U leadership probably wouldn't be happy about it.
No comment.
The U has since removed Dr. Bielman of mPhysicians from his university role as an interim vice president for clinical operations. The Regents also had a special meeting scheduled today, but they canceled it mid-morning, shortly before announcing that those negotiations would resume with all three parties. Back to you.
Danny, can the doctors and Fairview make their own deal, or does the U have to be involved?
That's kind of the big question. The U's Board of Regents passed that resolution saying they believe that they exceeded their authority, they said, mPhysicians did. But the physicians say that this isn't the final contract, it's just a framework that they've come up with Fairview. So stay tuned.
All right. Thank you, Danny.